The Union Community Center and Bronx Reach, along with partners of the Not 62 campaign, are coming together to encourage the Bronx community to drink healthier by launching the Bronx Healthy Zone Project. Now to share a little bit more about the project, we welcome the director of the Union Community Center, Dr. Vanessa Salcedo, and also the program manager from the Bronx Community Health Reach for Family Health, Kelly Moltzen. And thank you so much for coming and sharing with us here today.
Thank you.
So we talk about this here. Obviously, Dr. Salcedo, you've been here before and you've shared a little bit about this before, but give us a little bit about what's going on.
Well, it's been a year now.
Yes.
And it's been extremely successful. So if you remember at Union, we asked our employees to make a pledge. And you even made the pledge yourself.
Yes, I did.
And to not drink sugary beverages in front of our patients and in front of our community. We need to be leaders in our community to do this. And at the same time, it was very successful. We've had nurses that came up to me and said, I lost 20 pounds by just stopping the sugary beverages, and that's all she did. So what we did is that inspired us to create the Healthy Beverage Zone. So we decided to join the Not 62 campaign, and Kelly and I are the co-chairs of the Healthy Beverage Zone, where we are asking organizations across the Bronx to take this pledge and join us. And we've developed these great strategies for Bronxites and organizations.
Kelly, give us a little bit more about these strategies. Obviously, we know the Bronx is ranked number 62 when it comes to health in 62 out of 62 counties. And when we talk about this particular issue, there's an aggressive push, I believe, to really get people to know what's exactly in these beverages.
Yeah, so in order to become a healthy beverage zone, we are encouraging work sites especially, because we can have a big impact in the work site to be promoting health and have healthier workforces, and also save money by reducing the amount of sugar-sweetened beverages that we drink. So we have different levels of participation for becoming a healthy beverage zone. And these range from making the commitment, having organizational leadership on board, to educating the clientele and staff members about the benefits of drinking more water as an alternative to sugar-sweetened beverages, and then making organizational changes like making water more accessible.
And we're talking about collaboration. So who do you have exactly that's working in this new collaboration as you're getting things together here?
So it's a broad range, it's cross-sectional. So we have schools, we have health organizations, we have private sectors, community-based organizations. We're really reaching out to all the Bronx, and we know that this small change can make a huge impact in our community.
Give us some stats if you have about how bad things are, because people sometimes we think we're just making this up here, but how bad is it really?
So the Bronx, we continue to be last in terms of health outcomes in New York State. We're 62 out of 62 counties according to the Robert Wood Johnson Foundation County Health Rankings report. So we see this as a really good opportunity. We actually, about a third of Bronxites report drinking at least one or more sugar-sweetened beverages per day. And from those people, we're spending about $185 million per year. And that money could really be spent in a lot of better ways across the Bronx.
So,
and we know what this, in terms of not only stats, but the linkage that we know that these sugary beverages are causing diabetes in our community. And not only diabetes, but cavities in our kids, heart disease, and liver disease. And this is stuff that I'm seeing in my clinic on a daily basis.
So I remember you were here before, and I was teasing you before we went on air. You bought out this soda bottle, and then she had this thing full of sugar to show me exactly how much sugar I'm actually drinking with soda. How are you going about making the switch and really getting people aware, and what kind of response are you getting? Because, I mean, for me, it was just a moment of conviction, like, okay, I got to do something different, and I did. But how about other people? How do you get them to make the switch, and what's it been like?
Yeah, so at Union Community Health Center, we had some ready on board from the get-go. We expose different types of healthy beverages, fruit-infused water. We also encourage them by educating them and telling them that sports drinks and the energy drinks that they were drinking to stay awake, how much sugar they had. So really identifying sugary beverages that they weren't aware of that had all this sugar. So, education plus giving them other examples of healthy beverages.
Could you give us some examples of some sugary beverages that we should be staying away from?
Well, we know regular soda, sports drinks, sweetened tea. We forget about sweetened tea. We really think it's healthy. Sports drinks, a lot of my patients think that these sports drinks are healthy, and it's full of sugar, at least 9 to 10 teaspoons of sugar per bottle, so it's a lot. And they're drinking 4 or more a day, so if you cut that out, you make a huge impact on your health.
Yeah, I'm squirming right now while we're talking about this thing here. So overcoming obesity obviously is the biggest challenge that we have here in the borough. Do you feel a lot of progress is being made?
I do feel like there is a lot of movement. Actually, the Bronx won the healthiest. It's the Culture of Health Prize from the Robert Wood Johnson Foundation, showing that we really do have a lot of collaboration in terms of making healthier choices more accessible. But we also are up against a lot. We have food and beverage companies that spend billions of dollars marketing their products in our communities, and they do such a good job that a lot of us really feel fall prey to their marketing tactics. So we are up against a lot.
And there are some levels of participation that I think you want the public to really be involved in and be engaged in. So if somebody's watching and they're saying, listen, this sounds good, I want to get involved. If somebody says, listen, I want to really just get off this unhealthy eating and drinking, what do they do?
So luckily we're launching next Tuesday, April 18th, our website where you could get more information on different types of healthy beverages you could switch to and the unhealthy beverages to identify to avoid. And at the same time, we're asking our community partners, we're asking organizations to join us in this launch to learn about what it means to be a healthy beverage zone and be part of our movement.
So if people want more information, what do they do?
They can go to our new website, which again we'll be launching on April 18th. We'll also be having an event on April 18th at Hostos Community College from 11 to 12:30, where we'll be launching the event. In the meantime, you can follow us on social media, Facebook, Twitter, Instagram.
Well, Kelly and Dr. Salcedo, thank you so much for coming and sharing with us. And hopefully some people have got some more information. Certainly, I remember about a year ago you got me, and I was like, oh, and I've made some changes. I'm not saying I don't drink soda. Like I've made a lot of changes. So,
fantastic.
But definitely awareness. Thank you so much.
Thank you.
All righty, listen, taking a quick break. We're gonna have more show coming up after this. We'll be right back in just a few.